Welcome back, Dr. Bearman. And I want to ask you something. Are there a lot of over-the-counter treatment options available for headaches and even migraines? And can you help us understand how medical cannabis treatment differs from those treatments, and how someone should consider medical cannabis versus something simple as Tylenol, say?
Well, most over-the-counter medications are both anti-inflammatory and pain relief. Headaches can be caused by a tension headache, which usually goes along with stress. We do have some muscles in our skull that can go into spasm, and that can cause problems. If you have cervical spine degeneration, we talked about degenerative disc disease, that can irritate a nerve root and cause muscle spasm in your trapezius muscle. Sometimes you can have a sinus infection and you have fluid that are in your sinuses, and that can cause a headache. The other thing is that tension headaches and sinus headaches are different from migraine headaches. Migraine headaches tend to be more severe. There probably is a genetic component to migraine headaches. Oftentimes they have a prodrome, so that you see a flash of light or flashes of light, or you have pain in the back of your head and you know you're going to have a migraine. And a lot of people find that if they smoke some cannabis during the prodrome, that it will stop the migraine dead in its tracks. The use of cannabis to treat migraines has been around for hundreds of years. In 1892, Dr. William Osler, who's considered to be one of the fathers of modern medicine, wrote the first textbook of internal medicine, and in that he said that cannabis was the best treatment for migraines. After all, cannabis is an anti-nauseant, deals with pain, it slows down the speed of neurotransmission, and migraines are thought to be caused by pretty much uncontrolled excessive neural stimulation, and the cannabis is kind of like throwing sand in the machinery. Dr. Morris Fishbein, who was the editor of the Journal of the American Medical Association, starting in 1924 and going to sometime in the early 1940s, in 1942, said that cannabis was the best treatment for migraine headache. For those of your listeners or watchers here that are gluttons for punishment, they can read a 60-page article in the Journal of Cannabis Therapeutics written in about 2003 by Dr. Ethan Russo, a very well-known neurologist who understands the endocannabinoid system very well. So migraine headaches are something that respond well to cannabis. Tension headaches respond okay, but not quite as well as migraines. Now, one of the things that was on our list to go over were cluster headaches. Cluster headaches are really rare. I've had 3,000 patients that I've treated in the last 18 years or so, and there are only about 2 or 3 that I can think of that had cluster headaches. Well, I have had patients with trigeminal neuralgia, which can be very, very painful. And so if the cluster headaches are involving the trigeminal nerve, I can see where that would be very painful. And this one patient in particular had trigeminal neuralgia to such an extent that it was completely debilitating. And what she found once she started using cannabis is that she got almost 100% relief, which is really fantastic when those kinds of things happen. So that's basically it. The migraine, the tension, the cluster, and the sinus headaches are taken together are very common, and cannabis can be useful in treating certainly the migraine and the tension headaches, to a lesser extent cluster headaches. Sinus headaches, you may get some relief from cannabis, but you really need to treat the allergy or what's causing the sinuses to become full of fluid.
Gotcha. And can you touch up, we have a lot of female listeners too, and we get a lot of calls regarding PMS, not only with pain, but also having headaches accompanying the PMS.
I'm glad you mentioned that, because migraines, as you point out, are a very common accompaniment of women's periods. I think that later on in this lesson, we're going to talk about the use of cannabis for endometriosis and for PMS, but migraine headaches are a part of PMS, and so too are tension headaches. Women do get a lot of relief from the use of cannabis for PMS and for migraines that are associated with PMS.
And can you recommend a certain, are you going back to your 1-to-1 ratio, which I know you're a big fan of? I mean, what can you, what recommend about that?
Yes, I think 1-to-1, and I think, the pain can be fairly extensive. So, you want to start out at 5 or 10 milligrams of THC and CBD, and then increase it to 15 or 20 milligrams, whatever is the dosage that gives you the pain relief you're looking for without the side effect of dysphoria or dizziness or drowsiness that you're not looking for.
And are you talking sublingual absorption again, tinctures, sprays, or are you talking inhalation via vaping or?
Again, it depends on how long you want the treatment to last, the therapeutic effect to last, and how quickly you want it to start. So, if a woman has problems with PMS that go on for the 3 days before her period or the 3 days during her period, I would recommend taking the cannabis orally 3 or 4 times a day. If there is a spike in the pain, then obviously the respiratory route of administration would give rapid relief for that.
Gotcha. So I know you're talking about PMS and hormones, stuff like that. So will cannabis help if headache stems from the hormones, and that's just both for men and women? Does it? I know some people get headaches due to weather, blood sugar. I've been like that, low blood sugar, and I'm getting a headache, or even fatigue. Lack of sleep, and your body's off. And so, can you touch up on that?
Well, when you talk about hormones, you're really talking about fluid retention.
Okay.
And the fluid retention can cause headaches, and just the regular medication may be helpful for that. There's something called fiorinol, which is barbiturates, and another compound name escapes me right now. And there are other medications that can be taken to help relieve stress and muscle spasm. Propanolol is something that is useful in treating headaches. And if you have a headache, again, particularly if you don't have a history of headaches, you really do need to see your primary care provider, and they might refer you to a neurologist, because a headache, again, could be the sign of something serious. I mean, if you have a headache once in a blue moon and they're not unusual for you, that's one thing. But if you are having extreme pain in your head and you don't have any particular reason for it, that is a message to you to go and see your primary care doctor.
Great. So thanks for that as well. There are so many ways a headache can come on, and I think we've covered some of the ones that are most asked about, and it certainly seems that cannabis has been a widely recommended way of relieving headache pain for a long, long time.